In this video, Kelsey and myself will be discussing what to expect after your surgery. I'm going to go over what to expect after the first 24 to 48 hours.
And I'm going to go over what to expect for that first week and what to look out for after your surgery.
So after you are discharged from here, within the first 24 to 48 hours, some of the things you need to be cautious with and know about is the feeling of being dizzy, feeling some weakness, mainly for when you're walking or anytime you're getting up, changing positions, whatever you need to do once you are home. The dizziness and the weakness is typically caused from just the anesthesia as it's being filtered out of your body, and in combination with your pain medications and your muscle relaxers that you were prescribed by your surgeon. So for the first 24 hours, and maybe even beyond that, just make sure that your caregiver is with you at all times, just so that way if you are feeling a little lightheaded or dizzy, they can be there to assist you with walking around, moving around, getting in and out of a bed, or getting in and out of your recliner. One of the other things I want to discuss with you is pain. Your pain after surgery is typically the worst of it is the first 24 to 48 hours. So that is why it's important to start a good regimen with your pain medications. You can refer to some of the paperwork in your pre-op folder, your surgery folder. It'll go over recommendations as far as good regimens to start, things that work for other patients. So just make sure you are reading those notes and those forms that are in your pre-op folder as far as taking care of your pain and keeping it at a level that is controlled. Now when we talk about pain control, we use a number scale. Typically that number scale is 1 through 10, 1 being your pain is minimal, not so bad, 10 being the worst pain you've ever experienced. The goal is to typically keep patients below a pain level of 5. Typically once you hit 5 and higher, you get to a point where it's so uncomfortable that you can't really go about your day, you're feeling pretty miserable. So it is important to try to keep your pain level at 4 or lower, because that is when you'll still be able to kind of go about your day, do what you need to do, and be comfortable. Another thing to address would be your nausea. Some patients experience nausea after surgery. It is normal. That is why you've been given, most patients in this case will receive a scopolamine patch, which is good for up to 3 days. Make sure you keep that on for the 3 days. The other thing you will get is a medication called Zofran or ondansetron. That is an anti-nausea medication. And as long as you use that as prescribed, it helps significantly with nausea and avoiding vomiting. Along with that, when we talk about eating and drinking, with eating and drinking, it is very important that you start drinking fluids right away as soon as it is safe to do so. The more water you drink, the more electrolyte-rich fluids like Gatorade you drink, the better it is for you and your recovery. So make sure you start doing that right away. And then as far as eating, you want to make sure that you feel comfortable eating. You want to make sure you start with a light meal. You don't want to start with anything that has a lot of seasonings, things that are spicy, things that are overly acidic, just things that you know would normally cause stomach upset. You want to avoid those foods. Now when we say to start with something light, that's typically some soup, some crackers. If you tolerate that, okay. It is okay to advance your diet however you feel comfortable, slowly increasing the type of food you're eating, the consistency of that food, and things that are in that food. And then just making sure you're not eating too much or eating too fast when you are eating. Along with that, within the first 24 to 48 hours, especially with liposuction cases, you can expect majority of your drainage to happen between that time frame. After that first 24 to 48 hours, you will notice drainage both for liposuction and at just general incision sites. That drainage will decrease with each day. But majority of that drainage will happen within the first 24 to 48 hours. Lastly, one of the other things you can expect within the first 24 hours, the very next day after your surgery, is a follow-up call from one of the care team members. They will be calling you to just check in on you, make sure you're okay, make sure you are eating and drinking, make sure you're able to use the restroom okay, that your caregiver is able to help you. And then we're also there just to answer any questions or concerns you might have at that time when you receive the phone call.
Thank you, Mark. As you can see, surgery isn't really a joke. This is a big deal. Even for a small surgery, there's a lot that goes into it and into that first week of recovery, which is why it's important to utilize the package of instructions we give you at your pre-op, as well as your caregivers, and involve them every step of the way so they can help you with this process. What Mark was saying with the 24 to 48 hours is that you're also going to be sleepy waking up from surgery, so you may not be able to give them those instructions at that time, so make sure they're a part of this journey with you throughout every step. We also are always here as a resource for you if you do have any questions throughout. We will be checking in with you at that 24-hour follow-up call, and you always can call our urgent hotline or our office, or come and see us if you have any questions. The first week during your surgical recovery, even if it's a small surgery, can be a lot for people. It can be exhausting, it can be mentally draining. Another reason to have a good support network during this process and to take off a good amount of time for work so you can be prepared to utilize that if you need it. But the main thing is going to be patience. A huge part of this is waiting for your results after surgery, which I know you're so excited to see. Any surgery you get done, you're going to be very swollen to the point where it's going to be even hard to see your results. It's very common to have a lot of bruising, some drainage, and asymmetry, meaning unevenness to your surgical site. Everyone heals differently, so there's a lot of variation here, and it's important to just trust the process and use us as guidance as you need. Another big part of the first week is a bowel regimen. I know it sounds like a lot, but it is very common to be constipated after surgery, given the medications we're giving you, the lack of movement, as well as dehydration. We do give you something called Colace, which is a stool softener to help you after your surgery. However, if you haven't had a bowel movement within the first 3 to 4 days after surgery, or you're starting to experience discomfort from constipation, definitely let us know so we can guide you through increasing that regimen. Some things to look out for in addition to constipation after your surgery are going to be any type of redness or swelling that is uneven in either your legs or any surgical site. So again, I did say that you are going to have unevenness and swelling. However, if one arm or leg or a part of your body is significantly different in size than the other, that is something we would need to know, as well as if there's any increased redness or pain on one side versus the other, if there is increase in pain that is not controlled by your pain medication, if you're having any type of symptoms of cough, difficulty breathing, shortness of breath, chest pain, anything that is out of the ordinary of what we have already discussed, or if you're even just on the fence about something and wanting to call us, please let us know. Signs of infection are also important. Sometimes this can occur within the first week after your surgery. It is normal to have a little bit of redness and drainage to your incisions. Sometimes and even a little bit can open a small amount, but it's hard to see that under your dressings. So if you ever see any hot, red, raised areas, or if there's any thick, creamy, milky discharge coming out of anything, or if you have a fever, those things could indicate possible infection, and we would want to know about that as well. Otherwise, any other questions, please let us know. Again, we go through a lot of different types of surgeries here at HC Plastic Surgery. Everyone's journey in recovery is unique. We're here to guide you every step of the way.
So caregivers, you were brought up in this video quite a bit as far as being a resource for the patient. So I just wanted to kind of come on back and just kind of give you an idea of just how important your role is as the caregiver. It is crucial that throughout this process, especially in the pre-op process, that if you can be at appointments, if you can be part of conversations with surgeons and the care team, it would be a huge help to both yourself and the patient, ensuring that you're reviewing the videos and all the paperwork that is given to the patient, especially the pre-op instructions and the post-operative instructions. Those are all crucial documents that need to be reviewed, along with the videos, making sure you're watching them, pausing them if needed, replaying parts if needed. And then of course, just if you have any questions as the caregiver, you can call us, you can reach out to us. We are here to help you take care of your loved one after their surgery. We can help you with planning. One big asset to this is just from day one all the way till recovery is complete, just making sure that you have a plan, making sure that you know how things are going to go, a plan for making sure you can be at the appointments, plans for getting the patient to their surgical site on time in a timely manner, ensuring that they're doing everything they need to do prior to surgery, and then planning how you're going to take care of them during the recovery, making sure that if you cannot physically be there at some point in time during their recovery, especially that first week, making sure that you have a backup person who can be at that house, who can receive instructions and know how to properly care for that patient. With this process as their caregiver, you are one of the most important assets to them. They are going to rely on you completely, especially that first week. They're going to be very weak, very tired. They're going to, have some confusion in there between the medications, the anesthesia. They might not remember certain things that were instructed to them. So you have to be there as their main resource, the person who's reminding them of things they need to do, how they need to do things, making sure that you're keeping an eye on their surgical sites, their drainage, being there as that second set of eyes to where if something's going wrong, if something doesn't seem quite right, you can reach out to us to ensure that that patient is receiving adequate care and help from the care team here.